discussing on hepatitis virus. Hepatitis viral, a hepatitis caused by virus. As we can see, this is the effect of hepatitis. You have a liver disease. Hepatitis often affect liver. When hepatitis has causes a damage to the liver, it's called a liver cirrhosis. You can see here, you can see the diagrams of liver cirrhosis here. Here is non-alcoholic fatty liver. This is another cause of the liver problem, but this is non-alcoholic and it's not a hepatitis. Autoimmune hepatitis. Now often this liver cirrhosis is caused by hepatitis virus. This is a normal healthy liver. Now description here is that viral hepatitis is caused by one of the hepatotropic virus, which includes hepatitis A, hepatitis B, hepatitis C, hepatitis E. This hepatitis virus, hepatitis A and E, only cause acute hepatitis disease, while B and C cause acute and chronic hepatitis. Now what we mean by acute and chronic hepatitis, the acute hepatitis does not last over 6 months, while chronic hepatitis lasts over 6 months, even a years, some even in the lifetime it remains. In a general measure, when a person is said to have an acute hepatitis, the person or the patient deserves a bed rest until the acute phase is over. Avoid alcohol during the illness and for at least 6 months after clinical recovery. In case of hepatitis B, which can lead to chronic hepatitis, serologically screen sexually contact, that is, the person's sexual contact with the person must be screened. Like for example, now if husband is infected or diagnosed of hepatitis B, then the wife must be screened immediately. That's the word called serological screening. Must be screened immediately. When the spouse is found to be seronegative, that is anti-HBs negative, then the person should be given an active immunization for hepatitis B. Medicine treatment for a patient which is having nausea and vomiting. Metoclopramide IV oral 10 mg 8 hourly as required. Hepatitis B virus prophylaxis following exposure, e.g. needle and sticky injury. What I mean by prophylaxis is this: when a person is suspected to have a needle prick, a person that have a needle prick suspected the patient that has a sample is infected with hepatitis B virus, then the victim that has the needle prick should undergo a prophylaxis treatment. A prophylaxis is just a quick measures of treatment in order to prevent the development of the virus in the body system. Now, a person that is at risk of hepatitis B can be protected by passive immunization with hyperimmune serum globulin prepared from blood contain anti-HBs, that is hepatitis B surface antigen. It is essential that all categories of healthcare workers who are at risk of exposure, including cleaning staff, be fully vaccinated against hepatitis B. All exposure incidents must be adequately documented for possible subsequent compensation. Recommended post-exposure prophylaxis for hepatitis B in healthcare worker, that is hepatitis B surface antigen, hepatitis B surface antigen B and hepatitis B immunoglobulin. Here's the diagram, the tables of the source of patient and how the vaccine should be given to a patient which a victim or health care workers are found to find themselves in the area that are very risky, mostly laboratory scientists. Now, a vaccination status and antibody response status of healthcare worker. When the person is hepatitis B surfaces antigen positive, hepatitis B surfaces antigen negative, hepatitis B surfaces antigens unknown. Unvaccinated or vaccinated incomplete, HBIG IM 500 unit hepatitis B vaccine 3 dose at monthly interval. Initiate hepatitis B vaccination month 0, 1 and to 6, that is 1 to 6. HBIG IM 500 unit hepatitis B surfaces hepatitis B vaccine 3 dose at monthly interval. When the person vaccinated and hepatitis B surfaces antigen B 100 unit M, that person is a hepatitis B positive, does not require treatment. Hepatitis B negative, no treatment, and unknown has no treatment. Now, when the person is found to be vaccinated and hepatitis B surface antigen B is less than 10 units per ml, HBIG IM 500 units, repeated hepatitis B vaccine 3 doses at monthly interval. Negative, does not require treatment. HBsAg for unknown, IM 500 repeat hepatitis B vaccine for 3 doses at monthly interval. Now this hepatitis B immunoglobulin and our first dose of vaccines to be given simultaneously but at different sites. If the delay in obtaining hepatitis B surface antigen B result is more than 24 hours, initiate treatment as for the vaccinated, and hepatitis B surface antigen B is less than 10 units per ml. Thanks for watching, and if you like our videos, subscribe.